You're a registered nurse dreaming of becoming a doctor, wondering if it's even possible. Well, it is. And today I'm going to go over my journey from being a nurse to becoming a doctor, along with some tips and insights to help you along your journey. Hi everyone, I'm Dr. Claudia Ruiz, an internal medicine physician. I'm here to talk about my experience from transitioning from RN to MD. If you're considering making this leap, stick around. I've got lots to share. First, let's talk about why I decided to become a doctor. As a registered nurse, I was always curious about the doctor's role and their decision-making process behind patient care. I found myself constantly asking doctors about medications, procedures, treatments, and why they chose to provide those. My desire to grow and challenge myself continued to grow the more I worked as a nurse. And then I realized that becoming a doctor aligned well with my career goals. Okay, let's talk about the different roles between what a nurse does and what a physician does. A nurse's role focuses on executing doctor's orders, administering medications, monitoring patients, assessing changes in patient status, and more. While doctor's responsibility is to diagnose, order labs and tests, and develop treatment plans. Both roles are crucial, but they offer different abilities and autonomy. What other reasons would a nurse want to become a doctor? Well, it could be increased autonomy, increased decision-making power, and opportunities for specialization are just a few. As a doctor, you can choose a specialty. It can be from family medicine to surgery to radiology and much more. As a physician, you also have the opportunity to work in research, in academics, or even have your own private practice. Having a nursing background prior to becoming a doctor has its advantages. First, nurses are very familiar with patient care. They're also familiar with what a doctor role entails, so that gives them a better idea of what they're going to go into when they do become a doctor. And having a nursing background also gives you an edge on your medical school applications. Additionally, nurses understand the importance of teamwork and collaboration within team members within the medical system. Transitioning from a nurse to a doctor does not come without its challenges. Let's talk about them. Of course, it's a lengthy process, and it will require you to go back to school full-time. Because it is expensive to go to medical school, you will start accumulating debt. And also, you may have to relocate depending on where you get admitted to. Both medical school and residency is very demanding financially, academically, and requires a lot of commitment. Okay, let's run down the list of things you have to do to get into medical school. First, you have to make sure you have a bachelor's degree. You have to make sure that you complete prerequisite courses and take the MCAT. After that, you'll apply to medical school through the MCAS, then complete 4 years of medical school. It's important to note that you have to pass the USMLE to become a doctor. Then you apply to residencies of the specialty of your choice. Once you get into residency, this may take 3 to 7 years depending on which one you chose. For example, internal medicine is 3 years. However, certain surgical specialties are up to 7 years. Once you're done with residency, you have to complete the board exam. There you have it. Once you're done with that, you're a fully trained practicing physician. You're not looking to become a doctor, but you still want to advance your career as a nurse. Here are some options. You can become a nurse practitioner, a nurse midwife, or you can even pursue a doctorate in nursing. Each path offers unique opportunities and rewards. In conclusion, making a career change from a nurse to a doctor is challenging, but it is attainable. With careful planning and dedication, you will get there. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on health, wellness, and the medical field. If you have any burning questions regarding my transition from an RN to an MD, place your questions down in the comments below. Until next time.